You know, he's one of these young guys who has a lot of, let's just say, breathing or nasal resistance and upper airway collapsibility during sleep. Now, he is young, so sometimes that's hard to capture, even just with a routine sleep study. But he spent so much effort keeping his airway open overnight. So his main complaint is just this unrecoverable fatigue the next day. And that really affects, a young person's neurocognitive, functioning. Now, of course, if we let this go, down the road, he's going to have metabolic syndrome, cardiovascular comorbidities, all the bad stuff we know about sleep apnea. So, Dr. Zaghi, who trained with us here, was very sensitive, and he realized that he, the patient was going down the wrong trajectory. And this was absolutely the best time to intervene. He's young, he's going to bounce back, and we expect a full recovery from his sleep apnea. But anyway, the goal today then is to rotate it out and to fixate this in such a position that this will, it'll be a lot more stable. So when we're done with him today, he won't have that shift, he won't have that dip, but it'll be stable. My name is Stanley Liu. I'm an assistant professor in the Division of Sleep Surgery in the Department of Otolaryngology here at Stanford. I do the full scope of sleep apnea surgery. I did my undergrad here at Stanford. I did both my dental and medical training at UCSF. Finished a maxillofacial surgery residency at UCSF, followed by a sleep surgery fellowship with Dr. Riley and also the Stanford Otolaryngology Department. And this is my third year as full-time faculty here. Very smooth. It's never easy. Every step was methodical. I will say that anytime you move the facial skeleton, you will affect the bite, which is the functional occlusion, breathing, so airway issues, right, during awake or asleep, and then beauty, the facial aesthetics. So while our primary indication for him today was to improve the stability of his airway, we have to be very, very careful in also managing his bite and his beauty, the overall facial aesthetics. He happens to have an open bite, so we were able to correct that in the same operation. We made sure that his post-operative nasal appearance, the mid-facial appearance, and then everything is actually, harmonious as well.